Every mother deserves access to safe, supportive, and comprehensive maternal health care. But for too many, pregnancy is a time of uncertainty, especially for women of color who face higher risks of complications. In this episode, we'll explore how midwives and doulas provide vital support, the Medicaid services available, and how expecting mothers can advocate for themselves.
I am Dr. Heather Finletter-Hines. I am a certified nurse midwife for 25 years, serving Suffolk County. My role as a midwife entails full reproductive health care. That means from health care from puberty to menopause and everything in between. It deals with pregnancy care, so people who are thinking about getting pregnant, people who are pregnant, and then people who have delivered their babies. They help with breastfeeding, education of newborn, and they also do newborn care for the first 28 days of life. We get to know our patients. Our appointment schedule allows us the ability to really dive in more than scratch the surface, really get to understand this patient, understand their risk, and then by knowing your patients, you're able to mitigate that risk. Midwives are the best providers for that first reproductive visit, that first GYN visit, that pap smear that everyone is fearing. If you're having perimenopausal or menopausal symptoms, you can come to a midwife. People also think midwives only deliver at home, and that's not true. I would say only about 5% of births are actually done at home. The rest are done at hospital. Here in Suffolk County, there's a huge midwifery practice in the hospital setting, but we're also growing a robust community setting where patients are delivering at home and hopefully soon at a birth center. If you want to have an epidural, you can still have a midwife. So if you want pain medicine, you can still have a midwife. Midwives are the best provider in really diagnosing fourth trimester, so mental disorder, meaning postpartum anxiety, postpartum depression, postpartum blues, or postpartum psychosis. I think the first thing that you would do is Google, go to Google and Google who is a midwife in my area. Here in Suffolk County, we have Stony Brook, Northwell, and our community midwives. That's myself at One Love, Gaia, and East End Midwives. I think you should look at the reviews and then make a meet and greet. Every practice has a meet and greet for which you can go and meet a midwife in that practice and find out about their philosophy. With my practice, my C-section rate is 5%. If you look at hospitals here on Long Island that don't have midwives at it, right here in Suffolk County, there's a hospital that C-section rate is 54%. That's a hospital that you definitely want to have a doula at, and they should get midwives at. If you go online to New York State statistics and look at the local hospitals, I'm going to tell you the truth that hospitals with midwives right here in Suffolk County have lower primary C-section rates and increased VBAC, that's vaginal birth after cesarean rates, because midwives understand that their bodies are awesomely made and they can do it. So if we have more midwives at hospital here on Long Island, we're going to have lower C-section rate. So in New York, I am licensed and board certified. I have full prescriptive privileges. So if you needed something from contraception to anti-anxiety medication, I could prescribe that for you. Some midwives in the community setting are an out-of-network provider, and midwives who are in the hospital like Stony Brook and Northwell take insurance. If you're thinking about getting pregnant and you are thinking of out-of-hospital birth, you want to start thinking about your HRA, your health care spending, and that can help pay for your birth.
If you are expecting or need birth support, the Health and Welfare Council of Long Island is here for you. Please contact us today.
Hi, my name is Chris Gonzalez-Baez, and I am a doula. As a doula, I support families for birth and postpartum, give them emotional, physical, mental support. I'm there in the beginning, the middle, and the recovery part of it all. As a doula, I educate them on understanding what their rights are. So for that, You're able to give them all the information that they need. With C-section rates are a lot lower. We help increase breastfeeding so they can have the birth that they desire. I become part of their village. My goal is to just give them the space to be able to feel safe and be heard. We can text, we can meet for coffee, we can go on a tour to the hospital together. It looks different for everyone. I'm massaging them, giving them different techniques. So that would be a hip squeeze and walking around, reminding them to breathe, setting up the room in whichever way they would like. The idea is to really individualize the atmosphere as well as the experience. So a birth doula requires you to know techniques on how to help families get to a place of comfortability and understanding. I will go in and educate them and give them all of their rights. I then come up with a birth plan to understand what they would like. After you have the baby, a postpartum doula comes in and is there to support your 4th trimester. I go in and I help you in any way, shape, or form. Mothers need to be held and felt and understood and heard so that then she can heal and help everyone along the way. As the postpartum doula, I assist with the baby as well and anyone in the home. So whether it's the partner, siblings, even the dog, for instance, or the cat, it really requires a lot of understanding and giving and just being there for the mom, making food, making a tea, feeding the family. It allows for a smoother healing, and that's the goal as a postpartum doula. I was a pre-K teacher for 22 years, and I came in to become a doula to really help bridge many gaps and avoid traumatic experiences, and birthing shouldn't be one of them. I still stay in contact with almost every birthing person I have helped along the way, via birth or postpartum. I'm still here. If you had a birth before and you didn't have a doula, make sure you have one for your second one, even your 3rd and 4th. Find yourself a doula, it's worth it. You deserve it.
If you are expecting or need birth support, the Health and Welfare Council of Long Island is here for you. Please contact us today.
Hi, my name is Randall. I work for the Health and Welfare Council of Long Island. So the Medicaid coverage for birthing persons is pretty extensive. It covers your prenatal visits, which is inclusive of a doctor or a midwife, and you'll receive coverage for your doctor's visits, your sonograms, your labs, your screenings. It also covers your labor and delivery, and then your postpartum visits. Some add-ons are lactation support, family planning, and my favorite, which just added in 2024, is doula coverage. And with the doula coverage, you get 4 visits prenatal, your labor and delivery taken care of, and then 4 visits postpartum. Birthing individuals can find free or low cost birth support in several different ways. The first place I would tell everyone to check is talk to your midwives and physicians. They might have some sort of programs within their organizations. If you decide to give birth in a hospital system, I would definitely check within your hospital systems. They have community groups, they'll have lactation support, birthing classes, postpartum support, and they usually are free for those who are within the hospital systems. There are also organizations like LIDA, the Long Island Doula Association, and they are able to provide free or doula services on a sliding scale. They'll also be able to refer you to other programs outside of their services that they are connected with. Another organization that is available to Long Islanders is the Pitch program. They are available in Nassau and Suffolk County, and they provide different services like community baby showers, parent education classes, and they also will be able to connect you with home visiting services. This is a great resource for parents in need. Another great resource to look into are local nonprofits. Great examples of that are the Health and Welfare Council of Long Island and Women's Diversity Network. When you start your pregnancy journey, I think it's a great start to begin a birth plan. A birth plan just outlines what you want your birth to look like. Whether it's a home birth and the moon's out and you're in the grass, or you're in the hospital, Whatever that is, you should have that written out. Understanding the different types of birth workers that are available is the right way to start. Finding the physician or midwife that fits best for you. Interview them. It's just like job interviewing for a new employee. You need to find the physician, midwife, doula, birth educator that you feel safe with, because you're not going to be able to ask the questions unless you feel safe. Write a list. We are paying the doctors, we are paying the midwives to be there and take care of us. So every single question that you have is important for them to answer. Some new legislation that has recently been passed, thanks to Governor Hochul, is there are 20 hours of sick time additional during your prenatal stages. That could be used for any and all of your doctor's visits. A lot of women were missing their prenatal visits because they didn't have enough sick time to cover themselves, plus their prenatal visit, plus if they have a child at home that gets sick, additional 20 hours makes a huge difference. With this new legislation, it's very exciting for newly pregnant individuals. If your employer is not aware of the change in legislation, I would make sure that you can provide them with the legislation and give them time to do the research. There are some that are exempt if you have 4 employees or under, and some government employees.
If you are expecting or need birth support, the Health and Welfare Council of Long Island is here for you. Please contact us today.